Quarter of hospitals across the country are now facing critical staffing shortages as the Omicron variant continues to spread. Long-term care facilities are also feeling the strain. BNC's correspondent Astrid Martinez shows us how several states are now calling in National Guard troops to help overwhelmed medical facilities out.
Good cough, honey.
Once again, hospitals and other healthcare providers across the country are being stretched to their limits as a wave of COVID-19 cases from the Omicron variant spreads.
I've never seen anything like it since I've been a nurse. I was an LPN prior to becoming an RN, and I can tell you that there has been more deaths that I've seen the whole time in just 1 week that I normally see in a month, let alone in a day.
Data from Johns Hopkins University shows the U.S. is now averaging more than 700,000 new coronavirus cases per day. The country reported about 4.91 million cases in the week ending Saturday. That's more cases in 7 days than in April, May, June, and July 2021 combined. To help alleviate the strain, the National Guard has been called in.
Thank you for your service.
According to the Army Northern Command, the National Guard medical teams are now deployed in 10 states.
We were able to feel that these guys are working very hard and that our presence here is helping them just even mentally wise.
States like Ohio, Pennsylvania, Massachusetts, and Delaware have brought in the National Guard to help with patient care. Starting Monday, approximately 150 members of the National Guard will deploy New Jersey to long-term care facilities across the state. They'll assist with COVID-19 outbreaks and staffing shortages due to the virus. New Jersey nursing homes were devastated during the early stages of the pandemic and experienced some of the highest death tolls in the country.
This Omicron tsunami has changed the game yet again. We cannot summarily give up the fight. We need to remain on a war footing to ensure that we can get resources to where they need to be and when they need to be there.
You're going to select California?
200 California National Guard members were deployed across the state to provide help to overwhelmed COVID-19 testing centers. Governor Gavin Newsom activated the Guard over the weekend.
We have soldiers and airmen that may be computer programmers, they may be school teachers, they may be working in the community, business people, whatever that is. And they're filling very different roles this time. Roles as drivers or transport people within the hospital, food service, security, and patient observers.
Some 13,000 Guard members are helping across the country, assisting for at least 7 days and longer if needed. Astrid Martinez for BNC.
All right, and back with us, pediatrician and public health expert, Dr. Yolanda Hancock. All right, Dr. Hancock, I want to ask you, the president acknowledged that the administration, needs to do more to increase testing. Now, the administration set to deliver 500 million tests, directly to doorsteps. I understand that this is a delicate dance, where the moves are constantly changing, but why do we not have the basic steps down at this point?
I asked myself that same question just this morning. It's a Groundhog Day. You would think that this was March 2020, not January 2022. The fact that they're still negotiating and navigating through how USPS is going to deliver these tests leaves me scratching my head. We are on the upward rise, soon to reach prayerfully the peak of this current wave. And my fear is that we will get our testing supplies after we have crossed over the threshold of this peak, given the fact that they have not yet been placed in the mail, and we know how slow the USPS can be, I mailed my daughter a letter 3 weeks ago and she still hasn't gotten it. So that's my biggest concern, is that it's going to be after the fact, after we have felt really the full impact of this tsunami. I'm pleased to see that the National Guard has been activated, but what the federal administration also has to start working on is anticipating supply chain issues in hospital systems. What the Omicron variant is doing, instead of it being more severe, is causing an increased number of folks showing up for healthcare services, which means even more supplies are going to be utilized. PPE in terms of masks and gowns, swabs, every single thing, Tashani, that you can imagine in taking care of a patient is likely going to come up short. So I'm wondering, when is the federal administration going to be in a place of anticipation instead of reaction? That's what my hope as a public health expert is, and as a mother and community member.
Yeah. My last question for you, Dr. Hancock. I'm sorry to hear that you came in contact. I know you put your life on the line every single day, but that it got you. How are you quarantining? I think that's proper. How are you undergoing quarantine with
Right.
your young daughter in your home? How are you separating yourself?
Well, the good thing is that at the time that I was exposed, my mother was here. And so my mom was able to help me in taking care of my daughter until I did. I literally tested myself every other day with a rapid test. And I used the old school nasal pharyngeal to get all the way in the back of the throat and the nose without having to actually take the swab into your throat, because that's a whole nother issue that we can talk about later in terms of what are the issues around folks just opting to do a throat swab instead of a nose swab when the swabs weren't designed to do that. But my mother took care of my daughter. I tested every other day, and I also sent off a PCR in the appropriate timing so that I could come back to patient care, so that I could be around my daughter, knowing that I had not demonstrated symptoms and had tested negative on several occasions.